Causes of heart disease. Causes of heart disease occurs when there is plaque that clogs the blood vessels that lead to the heart. 1. Obesity. 2. High cholesterol. 3. High blood pressure. 4. Cigarettes. 5. Unhealthy lifestyle. 6. Age and gender. 7. Family health history.
Other facts from heart disease. 1. Rhythm disturbance. 2. Heart muscle thickens. 3. Electrolyte disorders, or cardiac drug abuse. 4. Abnormalities of blood vessels. 5. Depression.
How to avoid heart disease. 1. Healthy diet. 2. Quit smoking. 3. Avoid stress. 4. Adequate and quality sleep. 5. Blood pressure control. 6. Maintain ideal body weight. 7. Exercise regularly. 8. Take the recommended medicine. 9. Recognize the symptoms of coronary heart disease. 10. Routine medical checkups. How to handle medically. 1. Ablation. According to the British Heart Foundation, ablation, also known as catheter ablation, aims to control or correct heart rhythm disturbances, arrhythmias. How to treat heart disease is done by blocking the flow of electricity in the heart. The medical procedure uses heat, radiofrequency ablation, or freezing, cryoablation, of the heart area. 2. Cardioversion Cardioversion aims to return abnormal heart rhythms, arrhythmias, to normal patterns. The medical procedure is carried out by sending electrical signals to the heart through electrodes attached to the chest. Medical action for cardioversion usually only lasts about 10 minutes. 3. Coronary angioplasty and stents. Coronary angioplasty is a way of treating coronary heart disease with a focus on helping to increase blood supply to the heart. This medical procedure is performed using a special balloon that is slowly inflated into the coronary arteries. After that, the artery is fitted with a stainless steel mesh called a stent. That way, the blood can flow normally again. 4. Coronary bypass surgery. Coronary bypass surgery is intended to treat coronary heart disease that cannot be treated by angioplasty and stents or other procedures. This medical procedure is performed by creating a new shortcut to replace a blocked coronary artery with a blood vessel from the leg, arm, or chest. With coronary bypass surgery, blood flow to the heart that was previously obstructed can return to normal. 5. Heart transplantation. Heart transplantation is a medical procedure performed by replacing a damaged heart with a healthy heart from a donor. People who are going to undergo a heart transplant need a matched heart organ donor from someone who has died. Heart transplants. Blood flow to the heart that was previously obstructed can return to normal. 5. Heart transplantation. Heart transplantation is a medical procedure performed by replacing a damaged heart with a healthy heart from a donor. People who are going to undergo a heart transplant need a matched heart organ donor from someone who has died. Heart transplant surgery is generally recommended for people with severe heart failure who have not responded to other medical treatments. 6. Use of an implantable cardioverter defibrillator, ICD. An ICD or implantable cardioverter defibrillator is a small device used to treat arrhythmic heart disease. Generally, doctors recommend installing a defibrillator for people with heart rhythm disturbances who are prone to having a heart attack. This tool works by sending electrical pulses to regulate abnormal heart rhythms. 7. Pacemaker implantation. A pacemaker is a small electrical device that is placed in the chest or abdomen. This tool is used to treat heart rhythm disturbances such as bradycardia or a heartbeat that is too slow. Pacemakers work by sending electrical signals so that the heart can beat steadily. This tool replaces the role of the cardiac sinus node, which is not functioning normally. 8. TAVI. The transcatheter aortic valve implantation (TAVI) procedure is an option for treating heart disease, a type of heart valve disorder. TAVI is usually given to repair heart valves for people who are old enough or whose health conditions do not allow them to undergo heart valve surgery. This medical procedure is performed by making a small incision in the groin or chest to insert a catheter, a thin, flexible tube. This catheter is used to implant a new aortic valve in the beating heart. 9. Heart valve surgery. How to treat heart disease related to other heart valve disorders, namely heart valve surgery. The human heart has 4 valves. The job of each of these valves is to ensure blood flows through the heart in the right direction. Heart valve disorders can be in the form of valves that don't open fully, valves don't close properly, or heart valves leak. Heart valve surgery can treat this heart disorder and improve overall quality of life. 10. Drug therapy for heart disease. Launching WebMD. Drugs can help control symptoms of heart disease, prevent or treat heart disease according to its type. There are drugs used to dilate blood vessels, reduce chemicals that can narrow blood vessels, are antiarrhythmic, thin the blood, relax blood vessels, to control blood pressure. Herbal. How to handle heart disease. 1. Cinnamon lowers total cholesterol, bad LDL cholesterol, and triglycerides, a dangerous type of blood fat. This herbal remedy also lowers blood sugar, protecting against diabetes, which increases the risk of heart attack and stroke. 2. Garlic can also be a herbal remedy for heart disease. In a 2016 article that reviewed 20 previous studies, garlic was shown to significantly lower blood pressure. And another review study involving 2,300 people showed it lowered total and LDL cholesterol by as much as 10% in those with high cholesterol levels. 3. Ginger research shows ginger consumption can reduce the risk of high blood pressure. Research recommends 2 to 4 grams, or about 1/2 teaspoon to 1 teaspoon, a day to prevent this heart problem. 4. Turmeric. This substance is found in turmeric and gives the spice its rich yellow color. This offers major benefits and improve overall quality of life. 10. Drug therapy for heart disease. Launching WebMD. Drugs can help control symptoms of heart disease, prevent or treat heart disease according to its type. There are drugs used to dilate blood vessels, reduce chemicals that can narrow blood vessels, are antiarrhythmic, thin the blood, relax blood vessels, to control blood pressure. Herbal. How to handle heart disease. 1. Cinnamon lowers total cholesterol, bad LDL cholesterol, and triglycerides, a dangerous type of blood fat. This herbal remedy also lowers blood sugar, protecting against diabetes, which increases the risk of heart attack and stroke. 2. Garlic can also be a herbal remedy for heart disease. In a 2016 article that reviewed 20 previous studies, garlic was shown to significantly lower blood pressure. And another review study involving 2,300 people showed it lowered total and LDL cholesterol by as much as 10% in those with high cholesterol levels. 3. Ginger research shows ginger consumption can reduce the risk of high blood pressure. Research recommends 2 to 4 grams, or about 1/2 teaspoon to 1 teaspoon, a day to prevent this heart problem. 4. Turmeric. This substance is found in turmeric and gives the spice its rich yellow color. This offers major benefits for the heart, research shows, preventing dangerous blood clots, lowering cholesterol, and reducing inflammation that causes heart attacks and strokes. Adequate curcumin intake might also protect against heart failure when the heart doesn't pump blood as well as it should. And research shows that curcumin may be as effective as medication and exercise at improving blood vessel health.